Most of us know E. coli as normal gut flora, but certain pathogenic strains cause significant gastrointestinal disease worldwide. What makes E. coli fascinating is that different strains have evolved completely different mechanisms to cause diarrhea. We'll explore 5 major pathotypes: ETEC, EPEC, EAEC, EHEC, and EIEC. Each has a unique way of causing disease, affects different parts of the intestine. Picture this: you're traveling abroad and eat food or drink water contaminated with ETEC. The bacteria enter your gastrointestinal tract through ingestion. Once inside, ETEC colonizes the small intestine. How does it attach? Through specialized pili. Think of these as tiny hooks that help the bacteria bind firmly to the intestinal mucosa. Without these pili, the bacteria would simply be swept away by intestinal motility. After establishing colonization, ETEC multiplies and begins secreting enterotoxins. There are 2 types: LT, which is heat labile and destroyed by heat, and ST, which is heat stable and survives cooking temperatures. Now here's the key mechanism. These toxins don't destroy cells. Instead, they manipulate the intestinal cell's normal function. Let's see exactly how this works in the diagram shown here. The toxins activate a cascade inside intestinal cells that leads to massive secretion of fluids and electrolytes into the gut lumen, while simultaneously blocking absorption. So what's the result of this toxin action? There's prolonged hypersecretion of chloride ions and water by intestinal mucosal cells, while the reabsorption of sodium ions is inhibited. Think of it as turning on the water tap while blocking the drain. The gut becomes overwhelmed with fluid, resulting in significant watery diarrhea that continues over several days. This is classic secretory diarrhea. No blood, no inflammation, just massive fluid loss. The clinical picture is a traveler who develops sudden onset watery diarrhea, often with vomiting, abdominal cramps, nausea, and maybe low-grade fever. The key is the profuse watery nature. Patients can become dehydrated very quickly. ETEC is also a major cause of infant diarrhea in developing countries where sanitation is poor. Next is EPEC, enteropathogenic E. coli, historically the first pathogenic E. coli discovered. Like ETEC, entry is through ingestion of contaminated food or water. However, EPEC has a completely different strategy. EPEC specifically attaches to M cells in the small intestine. M cells are specialized epithelial cells that normally sample antigens for the immune system. Once attached, EPEC causes destruction of microvilli, those tiny finger-like projections that massively increase the intestinal surface area for absorption. When microvilli are destroyed, malabsorption occurs. The intestine can't absorb nutrients or water effectively, leading to watery diarrhea. Unlike ETEC, this isn't toxin-mediated, it's direct structural damage. The diarrhea is typically watery and non-bloody, and rarely becomes chronic. Clinically important, EPEC is the second most common cause of infantile diarrhea globally, right after rotavirus. So when you see an infant with watery diarrhea, in a pediatric setting, think rotavirus first, then EPEC. Now let's discuss EAEC, enteroaggregative E. coli, which has a distinctive appearance under the microscope. After entry through ingestion, EAEC uses aggregative adherence fimbriae, abbreviated AAF, to attach to the intestinal mucosa. Under microscopy, these bacteria have a characteristic stacked brick appearance because they aggregate together. EAEC produces the enteroaggregative heat-stable toxin, called EAST1. The combination of bacterial aggregation and toxin leads to shortening of microvilli, mononuclear cell infiltration, hemorrhage in the mucosa, and decreased fluid absorption. What makes EAEC clinically distinct? It causes persistent watery diarrhea with low-grade fever. The key word is persistent. This diarrhea lasts longer than typical acute gastroenteritis, sometimes weeks. EAEC is increasingly recognized as a cause of infant diarrhea in both developing and developed countries. Recent outbreaks have highlighted its importance in travelers and immunocompromised patients. Now we come to EHEC, enterohemorrhagic E. coli, also called STEC, or VTEC. This is the most dangerous pathotype. The classic source? Improperly cooked ground beef or unpasteurized milk, contaminated with cattle feces. The most notorious strain is E. coli O157H7. Remember this designation. After ingestion, EHEC colonizes the large intestine. It binds to colonic cells and destroys intestinal microvilli, causing decreased absorption. But what makes EHEC particularly dangerous are the Shiga toxins it produces, also called varotoxins, hence VTEC. There are 2 types, STX1 and STX2. These are cytotoxic toxins that disrupt protein synthesis in intestinal and vascular endothelial cells. The result? Bloody diarrhea without significant inflammation. This is called hemorrhagic colitis. The clinical picture is distinctive. Initially watery diarrhea, then progressing to grossly bloody diarrhea with severe abdominal cramps but little or no fever. The lack of fever is unusual for bloody diarrhea and should make you think of EHEC. Here's the critical complication: hemolytic uremic syndrome, or HUS. This occurs in about 10% of cases, particularly in children under 5 years. HUS is characterized by the triad of acute renal failure, microangiopathic hemolytic anemia, and thrombocytopenia. This is a medical emergency requiring immediate hospitalization. Finally, let's discuss EIEC, enteroinvasive E. coli, which mimics Shigella. After oral entry, EIEC invades the large bowel. Unlike the other pathotypes, EIEC directly invades epithelial cells, similar to Shigella. It even forms characteristic actin jet trails inside cells. These are comet-like structures that propel the bacteria through the cytoplasm. Interestingly, EIEC produces no toxin. The disease is entirely due to invasion and destruction of colonic epithelial cells. Clinically, patients initially develop mucus diarrhea. In about 10% of cases, this progresses to dysentery. That's bloody diarrhea with fever and abdominal cramps. This is true inflammatory diarrhea. EIEC is relatively rare in both developing and developed countries, compared to the other pathotypes we've discussed. Now let's consolidate everything, starting with the small intestine pathogens. ETEC causes travelers diarrhea with watery diarrhea, vomiting, and cramps. Mechanism: heat-stable and heat-labile toxins causing fluid hypersecretion. Think toxins, secretory diarrhea. EPEC causes infant diarrhea with watery, non-bloody stools. Mechanism: adherence to M cells destroying microvilli causing malabsorption. Think infants, structural damage. EAEC also affects the small intestine, causing persistent watery diarrhea. Mechanism: stacked brick appearance with toxin EAST1, shortened microvilli. Think persistent, prolonged course. Now the large intestine pathogens. EHEC is the serious one. Initial watery, then grossly bloody diarrhea. Minimal fever. Risk of HUS. Mechanism: Shiga toxins destroying microvilli and damaging blood vessels. Think bloody without fever. O157, H7. Undercooked beef. Children at risk for HUS. EIEC causes fever with cramping and watery diarrhea that may progress to dysentery. Mechanism: invasion like Shigella. Inflammatory diarrhea. Think invasive, inflammatory, rare. Key clinical distinctions: watery diarrhea. Think ETEC, EPEC, or EAEC. Bloody diarrhea. Think EHEC or EIEC. No fever with bloody diarrhea? Definitely EHEC. Persistent diarrhea? Consider EAEC. For prevention: proper food handling, adequate cooking of ground beef, pasteurization of milk, hand hygiene, and safe water are essential. Understanding these pathotypes helps you recognize clinical presentations,